Today we are looking at an important topic, the differences between clinical depression and bipolar depression. Although both fall under the umbrella of depressive disorders, they are quite different and each have their own symptoms, challenges, and treatment needs. Understanding these differences requires not only knowing the correct terminology, but also finding the right diagnosis and ultimately the right treatment. For example, did you know that bipolar depression is the most common mood disorder in bipolar disorder? It can often manifest as mild or chronic depression, but comes with a number of problems, such as a higher risk of psychosis and unusual symptoms like sleeping too much or eating more than usual. Clinical depression, or unipolar depression, on the other hand, has a different profile and often occurs later in life, with symptoms such as insomnia and loss of appetite. It is also not usually accompanied by the manic episodes that occur with bipolar disorder. We'll break down all these important differences, from symptoms and risk factors to the latest findings in neuropsychology and imaging. And of course, we'll talk about why an accurate diagnosis is so important, because treating bipolar depression with antidepressants is not recommended and can actually make the situation worse. So stay tuned as we find out what makes these two disorders different, why it matters, and what you need to know if you, or someone you care about, is suffering from depression. So let's talk about clinical depression, also known as major depressive disorder or MDD. It's more than just feeling down or having a bad day. It's a serious mental illness that can affect every aspect of your life, from how you think and feel to how you eat and sleep. Clinical depression is characterized by a deep, persistent sadness or sense of hopelessness that just won't go away. You may lose interest in things you used to enjoy, feel constantly tired, or have difficulty concentrating. These symptoms are often accompanied by changes in appetite and sleep patterns. You either eat and sleep too much or too little. Emotionally, it can feel like you are stuck in a dark place and cannot find a way out. Feelings of emptiness, guilt, and even anger are not uncommon. And for some, these feelings can lead to thoughts of self-harm or suicide. To diagnose clinical depression, it is important to know that these symptoms must be present almost daily for at least 2 weeks. Clinical depression is far from rare. Around 15% of people suffer from it at some point in their lives. It is one of the most common causes of disability worldwide, and its effects go beyond mental health. It can increase the risk of serious physical illnesses, such as cardiovascular problems, and make life feel overwhelming. But what are the causes of clinical depression? It's a complex mix of factors. Genetics, environment, and life experiences all play a part. For some people, depression runs in the family, while for others it can occur after a drastic life event, such as the loss of a loved one or a major life change. And sometimes depression can creep in without an obvious trigger. In terms of treatment, traditional remedies such as antidepressants, especially SSRIs and SNRIs, and psychotherapy are usually used, but these are not successful for everyone. Some people find relief in newer treatments that target other brain pathways, such as ketamine, which can work faster than conventional medications. Depression doesn't just affect your mood, it can also show up in your body. You may notice physical symptoms such as headaches, digestive problems, or even changes in the way you move and speak. Many people with depression speak in a flat, monotone voice that reflects their inner feelings. Clinical depression is often a prolonged struggle. Many people experience multiple episodes over the course of their lives, and if they have other health issues, it can be even more difficult to deal with. However, with the right treatment and support, it is possible to find relief and lead a fulfilling life. The first step to dealing effectively with clinical depression is to understand what it is and what it is not. Bipolar depression is a part of bipolar disorder, a mental illness known for its extreme mood swings. These mood swings range from energetic manic or hypermanic episodes to the deep valleys of depressive episodes. Bipolar depression refers specifically to the low phases within this state and is often the most difficult aspect of bipolar disorder. To understand bipolar depression, it is helpful to first differentiate between the types of bipolar disorder. In bipolar disorder I, sufferers experience full-blown manic episodes that can be very severe and even require hospitalization. Then there is bipolar II, which is characterized by hypermania, a less severe form of mania that does not reach the same extreme heights, but is paired with depressive episodes that can be equally debilitating. The depressive episodes in bipolar disorder can be very similar to clinical depression, with symptoms such as persistent sadness, fatigue, and loss of interest in daily activities. But there is one peculiarity. Bipolar depression is often associated with additional problems. It is more likely to be a psychosis in which a person loses touch with reality, or melancholic symptoms such as deep despair. There may also be atypical symptoms such as excessive sleep, hypersomnia, or overeating, hyperphagia, which are less common in unipolar depression. The difficult thing about bipolar disorder is its cyclical nature. Sufferers go through phases of depression, mania, or hypermania, and these cycles can vary in length and intensity. Depressive episodes tend to be more frequent and longer than manic episodes, which makes bipolar depression particularly distressing. It can seriously affect your ability to work, maintain relationships, and enjoy life, and is associated with a higher risk of suicide, especially during depressive episodes. So what are the causes of bipolar disorder and bipolar depression? As with many mental illnesses, it is a mixture of factors. Genetic factors play a major role. If bipolar disorder runs in the family, you are more likely to develop it. Brain structure and function also play a role, as do environmental factors such as stress or trauma. Unfortunately, bipolar depression is often misdiagnosed as clinical depression, which can lead to incorrect treatment. For example, while conventional antidepressants seem to be the most obvious choice, they are not usually recommended as the sole treatment for bipolar depression. They can sometimes trigger a switch to mania if not counterbalanced by mood stabilizers or antipsychotics. This is why an accurate diagnosis is so important. It is the key to the right treatment approach. Dealing with bipolar depression is definitely difficult, and current treatments are not perfect. Mood stabilizers such as lithium or anticonvulsants, as well as atypical antipsychotics, are commonly used, but there is still a need for more effective options that specifically target bipolar depression. In short, bipolar depression is a major component of bipolar disorder, characterized by frequent and severe depressive episodes that can be very difficult to cope with. The impact on daily life is significant, and early, accurate diagnosis is crucial for proper treatment. Treatment options and management for clinical and bipolar depression. Clinical depression, treatment options. Treatment for clinical depression, also known as major depressive disorder, MDD, often involves a multifaceted approach that combines medication, therapy, and lifestyle changes. 1. Antidepressants, * common medications. The most common medications used to treat clinical depression are antidepressants, particularly SSRIs, selective serotonin reuptake inhibitors, such as fluoxetine, Prozac, and SNRIs, serotonin norepinephrine reuptake inhibitors, such as venlafaxine, Effexor. These medications work by balancing neurotransmitters in the brain, which can help improve mood and emotional stability. Asterisk response to treatment. While antidepressants are effective for many people, they are not effective for everyone. Some people may need to try different medications or combinations before finding what works best for them. It's also important to know that it can take a few weeks for antidepressants to start working, so patience and ongoing support are important. 2. Psychotherapy. * cognitive behavioral therapy, CBT. One of the most effective forms of therapy for clinical depression is cognitive behavioral therapy, CBT, which helps patients identify and change negative patterns of thinking and behavior that contribute to their depression. * Other therapies. Other forms of therapy, such as interpersonal therapy, IPT, and mindfulness-based cognitive therapy, MBCT, may also be helpful depending on the needs of the individual. 3. Lifestyle changes. * exercise and diet. Regular physical activity and a balanced diet can have a positive impact on mood and general well-being. Exercise in particular is known to release endorphins, which can help alleviate some symptoms of depression. * sleep hygiene. Maintaining a regular sleep schedule and creating a restful sleep environment is crucial, as sleep disturbances are common in depression. 4. Continuous care. * long-term treatment. Clinical depression often requires long-term treatment and care. Even if symptoms have improved, continuing medication or therapy as prescribed can help prevent a relapse. Bipolar depression, treatment options. The treatment of bipolar depression is more complex, as both the depressive and the manic or hypomanic episodes need to be treated. 1. Mood stabilizers. Asterisk first-line treatment. Mood stabilizers such as lithium are the cornerstone of treatment for bipolar depression. Lithium is particularly effective in reducing the risk of manic episodes and is also associated with a lower risk of suicide. 2. Antipsychotic medications. Asterisk second-generation antipsychotics, SGAs. Medications such as quetiapine, olanzapine, often in combination with fluoxetine, and lurasidone are approved for the treatment of bipolar depression. These medications can help manage both depressive and manic symptoms, but they have potential long-term side effects that need to be closely monitored. 3. Antidepressants to be used with caution. Asterisk combination therapy. Antidepressants can be used for bipolar depression, but they are usually combined with a mood stabilizer to avoid triggering manic episodes. The use of antidepressants alone for bipolar disorder is generally not recommended due to the risk of triggering mania or rapid cycling. 4. Psychotherapy. Asterisk integrated approach. Therapy is also crucial in the treatment of bipolar depression. Manualized therapies, such as CBT, that are specifically tailored to bipolar disorder, can help patients better manage their symptoms and improve overall outcomes. 5. Electroconvulsive therapy, ECT. Asterisk. For treatment-resistant cases, ECT is considered a highly effective option, especially for severe cases of bipolar depression where other treatments have not worked. 6. New treatments. Asterisk new options. Treatments such as lamotrigine, lurasidone, and even newer approaches such as ketamine infusions are currently being researched. These new treatments are promising, especially for patients who have not responded well to conventional therapies. The role of therapy and support. Regardless of whether someone is suffering from clinical or bipolar depression, therapy and support play an important role in treatment and recovery. 1. Therapy. Asterisk CBT and beyond. For both disorders, therapy helps sufferers develop coping strategies, better regulate their emotions, and recognize the cognitive patterns that contribute to their symptoms. Regular therapy sessions can also provide a safe space to discuss and cope with the challenges of depression. 2. Support groups. Asterisk shared experiences. Support groups offer the opportunity to share experiences with others who understand what you are going through. This can be incredibly valuable as it helps to reduce feelings of isolation and create a network of encouragement. 3. Ongoing medical support. Asterisk regular monitoring. Both clinical and bipolar depression benefit from ongoing medical care, including regular checkups with a healthcare provider to monitor symptoms, adjust treatment as needed, and treat any side effects. Conclusion. In summary, while clinical depression and bipolar depression are both serious illnesses, they are not the same thing. Clinical depression, or major depressive disorder, is associated with a persistent low mood and loss of interest in everyday activities, typically without the mood swings that occur in bipolar disorder. Bipolar depression, on the other hand, is part of a larger pattern of mood swings that includes both depressive episodes and manic or hypermanic episodes, making its treatment more complex. If you or someone you know is struggling with clinical or bipolar depression, you should definitely seek professional help. Accurate diagnosis and tailored treatment are key to effectively managing these conditions. Don't hesitate to reach out to mental health professionals or utilize resources like crisis hotlines if you need immediate help. Thank you for watching. If you found this video helpful, please give it a thumbs up and consider subscribing for more mental health content. And don't forget to leave a comment below if you have any questions or want to know what topics we should cover next. Take care, and we'll see you in the next video.